You're watching McLaren Port Huron's Today's Health, and we're talking in our program today about congestive heart failure with board-certified interventional cardiologist Bashar Samman. Dr. Samman, I want to talk to you a little bit more about patients that have advanced congestive heart failure. What are their treatment options?
There are certain classes of medication we want patients to be on, and especially in people that have weak muscle of the heart. The first class of medications, what we call the ACE inhibitors, or their cousins, the angiotensin receptor blocker, the ARBs. There is a lot of different medication. I'm going to name few, but that's not limited to them. Lisinopril, losartan, Diovan, any one of those would work. It's very important to be on one of this medication if you can tolerate it, because that class of medication has been known to reduce our risk of getting in more trouble and dying from heart failure. Mm-hmm. I did not mention that. Unfortunately, heart failure is a deadly disease. Mm-hmm. So treatment is not only for me to get better, but to live longer. Mm-hmm. And when we look at any treatment, any medication we give can affect one of two, and hopefully both, make us feel better and live longer. The first class, what we call the ACE inhibitor or the ARBs, can achieve both. The second class of medication we call the beta blockers, which is like carvedilol, metoprolol, and a long list of medication, can achieve both of them. The combination of those two medications is very important in anybody that has heart failure. The third class of medication we talk about are water pills, diuretics, basically taking that extra fluid. That class of medication will make us feel better, but not live longer. Okay. And that's why a lot of time we may have somebody on a water pill, on a diuretics, on furosemide or Bumex, whichever one it is. But later on we cut down the dose, because once we know that we took away the extra fluid, we only use it as needed. We don't want to keep it on. We have a class of medication, or a medication called spironolactone. We like to add it if we can. So as you noted, there are certain medications that are must. And anybody that comes with heart failure, if he comes into my office and they have heart failure and they're not on those two classes of medication, I have to explain why not. In my mind, I have to see why they're not taking this. Mm-hmm. They make a difference. And that's why people say, well, I'm feeling good, I don't want to take them. Because you're feeling good, we have to take them. This way, we stay feeling good.
Okay, all right. And we're going to talk a lot more about that, staying well, in our next segment.
Which is very important in this disease.
Yes, I can tell that. It's a long haul disease.
It is.
You hope it's a long haul disease. Are there procedures or devices or things that can support the heart?
Absolutely. You know, if we talked in the beginning about procedures, one of the procedures we talk about, if we have blockages in the arteries, angioplasty, stenting, or bypass, if it improves the blood flow, improves the muscle, that's a procedure. Although initially we may say, well, doing the procedure to solve the blockages, but the purpose is to do the procedure to solve the blockage and improve the muscle. And if we improve the muscle, we lessen the risk of heart failure. Same thing with valves. If I have a leaky valve or a narrowed valve, having surgical intervention or replacement of my valve would solve the risk of heart failure and improve my risk. So those are targeted to certain diagnoses to help that. But then we have other procedures. We have something we call biventricular pacing, which is a special pacemaker. If the muscle of the heart is enlarged and weak, and we have certain changes on the EKG that we call left bundle branch block, the muscle is not efficient. It's not pumping in synchrony. It's not pumping the way it should be. A certain type of pacemaker, not the one that we put because our heart rate is slow, the one we put to bring the muscle back together and improve the function of the muscle of the heart. At the same time, if our muscle of the heart is weak below a certain range, and what's the range? Some of our patients may hear what we call an ejection fraction. Mm-hmm. A normal ejection fraction is 55 to 60, and that reflects the amount of blood that the heart pumps with every cycle. The lower that number, the weaker the muscle. When we get below 35%, then we increase our risk of having a very erratic, irregular heartbeat that can get us in a lot of trouble. including feeling dizzy, passing out, and unfortunately in certain instances even dying. In that group of people, a defibrillator is indicated, which is like a pacemaker, and a lot of times it's a combination with a pacemaker. If the heart goes into that irregular rhythm, it will get it back, shock it back to be regular, and prevent us from getting in trouble. Then the next stage, when we have very advanced heart failure, and in spite of the maximum medication that we have, we're still extremely ill. We can't function. Then we get into the procedures of either heart transplant or what we call LVAD, left ventricle assist device, which is, if in a way you want to say, is the artificial heart to support the heart and function either completely instead of the heart, like heart transplant, or in LVAD, depending on the type of an LVAD, taking most of the function of the heart because the pump is so weak, it's not able to function in spite of all the medication that we give.
So is these devices that you're telling me about the end, and to and including heart transplant, this is something that either the patient has had a very acute injury, so they're very sick suddenly, or you've tried everything else?
Yes. You know, if we have an acute injury, if I have somebody who comes in with a large heart attack, and we go in and do an angioplasty, a stent right away, and restore the blood flow, we hope by doing that the muscle is going to get better. Some of us, things happen rapidly and we get better, but some of us, unfortunately, it takes time. In that group of people, having something like the LVAD, the left ventricle assist device, will give us time to give the muscle the time to heal and recover. In extreme cases where, you know, unfortunately recovery is no longer an option, whatever the cause of the weakness of the muscle of the heart is not going to recover, then transplant or permanent LVAD will be the option.
Okay. Very good information, but I want to talk to you a lot about how to stay well and how to avoid this, but first we're going to take a break.
Thank you.